So I'll be presenting on the use of thermal camera photography to evaluate tissue perfusion before and after mastectomy. And I would like to thank the University of Alabama as well as Dr. Grant for allowing me to present on this research. So for some background, during a mastectomy, one of the most important things for patients that are going to be undergoing a direct reconstruction following is to make sure that the tissue pocket that's created for the breast implant is thick enough to hold the implant without risking rupture or infection or loss of a tissue implant, because of course, we don't want to have someone undergo an additional surgery. We don't want to have someone undergo extensive antibiotic therapy. So making sure that the flap is adequately perfused and able to hold a foreign body is very important. And one of the ways that you can do that in the operating room is by injecting something called indocyanine green dye. And essentially what that does is it fluoresces around the breast tissue to kind of give an idea of how blood flow is able to perfuse the tissue intraoperatively. However, it's very expensive. It can cost about $1,300 for 6 powders that you would use to create the dye. And that doesn't even take into consideration the supplies that are needed for this technology. You have to be able to have a screen that shows it fluorescing. So it can be quite costly. And in some hospitals where cost is a burden, we want to see if we can prove that this use of this camera would be equal to the use of dye, because it's a one-time purchase of about $250 up to, if you wanted a more technologic camera, you can even spend up to, I think, $1,200, but the one we purchased was right in the middle at about $500. So several studies have already looked into the use of IR thermography. They found that it's cheap, it's non-invasive, and it's efficient, because all you have to do is take a picture. You can do it before surgery and you can do it during surgery. You can also do it after, which provides another advantage, because injection of the dye is only available during the surgery. So there's no comparison point really to the perfusion before. So no one has currently looked at its use in mastectomy flap perfusion, although because mastectomy flaps, of course, are holding a foreign body, we feel like this would be really valuable for different institutions to have access to. And some of the studies that have currently been done are quite small. And that being said, our patients that we've been able to look at currently is also small, but we're hoping to eventually get it into a larger, eventually have larger patients and more data. So the goal of this study is to use this smartphone thermography to predict surgical outcomes after mastectomy and compare its use to a traditional ICG dye system. So we've used our FLIR1 thermography camera to take pre and then post mastectomy photographs directly over the chest. We've recorded these images. We have operating room temperatures and case details. And then we also have videos of ICG injection when it was given. Not all surgeries employ the use of ICG dye, but if they did, we try to get a video of it as well. And then we're taking these photographs and comparing them using fluorescent pixel intensity and color enhancement to try and create a predictive model for surgical wound healing and outcomes. And we'll develop a scale to compare thermography to the ICG dye that's currently being used. So I don't think I was able to get a video to load. It was quite large, but essentially what this example would show is green colored fluorescence that goes around the mastectomy flap. And as you can imagine, this is quite subjective. It's kind of up to each surgeon whether or not this is adequate perfusion, and not necessarily as objective as this is good, this is bad, because it is observing the kind of movement of the color. So they'll do it on this breast. I believe she had a bilateral mastectomy, so they'll do it to each breast individually. And you are able to kind of see from this image the hue of the green, and that would be circumferential around the breast tissue. So for us, we have taken these photos, which you can see. These are just an example of the ones we've taken. I think we have about 11 so far. These were some of the ones that were I felt like the most indicative of what this technology can show. So in this first image on the top left, you can see she had a unilateral mastectomy. Looks like a pretty good perfusion. So yellow is going to be the most perfused or the warmest. And then the purple or the darker, almost blue hue is going to be where it's a little bit cooler. And you can tell that post-mastectomy, kind of right around where this incision line is and around the nipple, there is a little bit of a decreased color, which indicates decreased heat coming off of the breast. In the picture right below it, this was a bilateral mastectomy. You can actually appreciate that this left-sided breast actually has pretty similar perfusion to it before. The one on the right is a little bit less perfused, which is good to know for wound healing, that the right side might be a little bit more prone to having an infection. We're working on kind of developing a predictive model for that. On the top right, you can see, I actually included this because I felt like it was kind of a confounder image. The towels were left in the breast pocket, which you can tell that the camera is able to pick up on that. And of course, that would be confounding data because towel is going to be cooler and it's going to be filled with liquid and it's going to bring down the temperature. However, you can still see, even with this image, that the surrounding breast is still well perfused and still shows up with that light white yellow color. Below, you can see an example of decreased perfusion almost on bilateral breasts, where it kind of goes to that pink. And then the one below that actually showed better perfusion postoperatively than beforehand. You can see that it's all yellow, whereas beforehand it could be a little bit darker. And of course, this study does have multiple confounders. Different solutions that you put on the breasts are, of course, going to change the temperature. We try to make sure that we don't do it immediately. We don't take the photographs immediately after betadine or other antiseptics are applied to the patient in an attempt to avoid picking up like a false color read or anything like that. And we try to keep the operating room temperature at least recorded so that we can understand if the room is just in general cooler. Of course, the patient is going to be cooler as well. But what's great is that we can take it preoperatively in order to compare. And that way it's not just being taken postoperatively when all of these confounders might be coming into effect. At least we can kind of have a comparative model to beforehand. And we're hopeful that this study will provide an avenue for hospitals without the resources to spend money on the ICG dye for every single breast mastectomy. This would be a one-time purchase of a camera that could really make an impact on ability to predict wound healing outcomes following mastectomy. And thank you so much for my presentation. These are my references.